Everybody, my name is Shaylin. I'm currently an educational psychologist at Crossroads School. So this evening, we're going to be discussing what is ADHD and how children are experiencing it. What does it feel like to have ADHD? Oh, it feels like my brain is understeering. So what this means is that often children or learners with ADHD have an underactive nervous system. Their nervous system runs slow, and communication between the neurons is not as fast as it is in most people. So, for example, trying to stay awake while driving. Often we would play music or play games in the car to try and keep our nervous systems awake. So children with ADHD are trying to wake up their nervous systems. So sometimes the erratic behaviors we see in the classroom, for instance, is actually their nervous system trying to wake up. This is the reason why often hyperactivity is treated with a stimulant medication. It revives their nervous system so that the learner can focus their attention or be more available for learning. Okay, so attention deficit hyperactive disorder is one of the most common neurodevelopmental disorders. It often starts in early childhood and then last into adulthood. So children, most boys have been diagnosed with ADHD. As girls are often, it's masked by something else. Symptoms often appear during the ages of 3 and 4, but most diagnoses occur around grade 3. ADD is an old term which was previously used to describe the inattention part of ADHD, but now falls within inattention. Now falls with ADHD with inattention. So, according to the DSM-5, which is the new diagnostic statistical manual of mental disorders, the word ADD is not even referenced in there. So, what happened is that they put it under the term ADHD with inattention. So ADHD is split into basically ADHD with inattention and hyperactivity, and then it goes into mild, moderate, and severe. So some of the causes of ADHD is obviously brain injury, exposure to environmental risk, alcohol and drugs during pregnancy, even a lack of oxygen during pregnancy, and sometimes genetics has some role to play in it as well. So here are some of the what ADHD might look like according to the DSM-5. So the DSM-5 has criteria or symptoms regarding inattention and hyperactivity. So a child might fall under the inattention category and then or the hyperactivity category. But I'm not going to go through it. You guys can read through it on your own. Six or more of the following symptoms have to be present or prevalent for a diagnosis to occur, but it has to be prevalent for 6 months or more, and in two different settings, meaning in the home environment and at the school. Children who are over the age of 17, only 5 symptoms need to be prevalent over the 6 months for a diagnosis to occur. Inattention often, if you look at the inattention side, so for instance, some of the symptoms could be often misses detail, difficulty maintaining attention, often loses things necessary for tasks, forgets daily activities, often distracted by unrelated stimuli, avoids or dislikes engaging in tasks that require mental effort. Something in the hyperactivity side would be seeking movement, blurts out answers, interrupts, has difficulty keeping quiet, leaves seats in situations when remaining when you're supposed to remain seated. This is just a picture that shows some of the symptoms that you might come across. Okay, and then what ADHD feels like. So for children who have ADHD, it's like their motor is constantly running. So their motor is constantly running and they can't stop that motor from running. And it's hard for them to reflect back on how to slow that motor down. So for these kids, when faced with these kind of situations, are often quite reactive. They constantly fidgeting, can be dysregulated, and they can be reactive. Reactive in the sense that when faced with a social situation, they might react before they think about the consequences or the punishment. And also kids with ADHD might develop secondary oppositional attitudes, especially if they feel that something is mentally draining. So it might feel like they saying no to wanting to do things that they find they struggle with. You will see that sometimes they might present with low self-esteem, anxiety, that kind of thing. So learners also, and then that's just a snippet of that explaining where learners with ADHD have an underactive nervous system, and obviously the medication or is trying to wake up their nervous system to say, okay, we need to focus on one thing and be available for learning. Here is just a picture of how ADHD affects the brain. It often affects the brain in certain areas. There's the areas that regulate behavior, and any injury to this sections of the brain can lead to a development of ADHD. Okay, and then ADHD in the classroom. ADHD. So what's important is placement. So placement, not just in the classroom, but placement in general. Are they in the right school? Are their needs being met academically? It can be a struggle to manage an ADHD class in a bigger classroom, as a lot of the kids in a bigger classroom might have other underlying problems, and it's difficult for the teacher to just focus on one of the kids at a time. So a smaller classroom might be beneficial, but there are techniques, there are steps to take that you can take to make them feel part of the classroom, to make them feel included in the classroom, which I will talk about. We got to one of the, and you got to remember that there's no one recipe, or each and every ADHD learner is unique, is different. What works for them might not work for you, might not work for another learner who has been diagnosed with ADHD. However, certain adjustments in the classroom can make a big difference. So some more tips with managing ADHD in the classroom. Observations are important, especially observing the learner in the classroom, taking note of those symptoms that were said previously. Is the child forgetting things? Is the child being internally distracted? Just to make, as a teacher, it's important to just make a note of it. So, so when somebody asks, how is his focus or how is his attention in the classroom, you have a record of him forgetting things. And if the parent says that they have forgotten things at home also, then it kind of gives you an idea, and then you can maybe bring up the next step, which is maybe getting them assessed and taking it further. Placement in the classroom is also important, so maybe placing them near the teacher, or placing them in a place where you can placing them make placement in the classroom, maybe placing them close to you as a teacher, or next to a more responsible child who can maybe aid them or be a buddy, like a buddy system. Homework tasks can be quite a challenge. it's good to have a buddy system in place to maybe check that, to ask the buddy to check that that learner with ADHD um, is is writing their homework down, is doing what they're supposed to be doing. Often we get kids that don't, with ADHD, don't write their homework down, and then they go home, and then their parents are like, "Do you have any homework?" And then they show their homework book, and then there's nothing written down, and then the teacher gets an email, and then there's, but then tension raises, and then so it's a good way of getting the learner to actually write down their homework. For younger kids, maybe making a copy of the homework and sending it to the parent. Time limitations is important, having structure in the classroom, and establishing routine. So time limits, short time limits, having clear structure is important, and rules. So if they break a rule, they know what they're being punished for, they know what the consequences are. And short, precise instructions, meaning that don't give too many instructions at a time, because what will happen though is they will often forget the other instructions, and establish routine. Some tips that might help managing ADHD in the classroom. So we can use distraction blockers, earphones, headphones, just to prevent them from being distracted by what's happening around them, to make them focus on what's happening in the classroom. As a teacher, it's important to make use of visual aids, audio aids in your lessons. Make it fun, make it interesting. I know when I was teaching and we used to do plays like Shakespeare, I used to do all the character voices for them. So like the witches, and then Macbeth's voice, and the king's voice. So it kind of like makes it more fun for them, makes it more interactive. Allow for movement breaks. So allow them to move around class, maybe allow them to get up, walk around. And it's also important to just supervise them if necessary. And chunking is obviously breaking those instructions into smaller pieces, and also when giving work, give one task at a time. Don't give multiple tasks at a time, because they'll either forget, or they will be movement seeking, get distracted, come back, and then they'll forget what they've been doing. So how to reach children with ADHD? An emotional bond is quite important. So how to create an emotional bond with an ADHD learner is to compliment them, to give positive reinforcement, tell them well done, pat them on the back. They did something great, even though if it's a small task, because many of these learners might develop low self-esteem because they know that they're aware of their struggles. So by patting them on the back or telling them well done, you did that task for me quite excellently, helps them boost their self-esteem. And also it's good to communicate with the parents regarding what strategies worked, what strategies didn't work, and how you manage the child in the classroom, and what strategies have been put in place. A good thing is also to make sure that he or she in the classroom feels included. They are not being ostracized by their peers for being a learner with ADHD. They feel included, they feel accepted, and focus on the positive and not the negative. Okay, parenting tips for coping and connecting with ADHD. Okay. So it's important to have clear rules and to create structure in the home environment. Structure meaning get them to do certain tasks. So write them down on a piece of paper and tell them, okay, you need to be dressed by this time in the morning, you need to be dressed. You need to do this task by this time, and you need to be ready for this extramural at this time. And don't think of punishments, think of rewards, because if you think of punishments, then they are not going to want to do the task. So structure is important. Reward your child with affirmation, meaning don't give them money, such as material things. reward them with other things like giving them a hug, providing compliments, I'm proud of you, well done. Some rewards could be playtime with friends, Lego, going to a movie, visiting a cycling or skateboard park. Punishment can be tricky, especially for older kids, but it's good to make sure that however you punish them, they know exactly what they're being punished for and why they're being punished for. It works mostly, so smaller children, a timeout might work a little bit better. Obviously, with older children, just making sure that they know exactly why they're being punished is important. When asked, so when it comes to doing chores, give one instruction at a time. Often at times they will forget multiple instructions. So it's good to give them one chore at a time and see how they cope with it, and then maybe give them another chore, maybe doing it weekly or daily. It depends on how they cope with it. And also it's important to have a sense of humor. These learners are gonna push buttons. They are button pushers. They're gonna make you feel frustrated and angry. And the important thing is to not get angry, because when you shout and scream at them, they feel like you're just putting them down, and that could lead to low self-esteem. Okay, so another parenting tip for coping and connecting with ADHD children is to have a time where you and your child can sit down together and have your time. Yes, I understand this can be difficult because many parents are tussling between getting them to school, getting them home from school, homework done, extramural, getting ready for the extramural, getting ready for this function or that function. It can be difficult, but it's important to, when you're doing your goal, your structure of rules, and that is to include it in there. So maybe 10 minutes of just having a chat, or them doing what they want to do. So join in on what they want to do, because what that does, it strengthens your emotional bond with them, and it also gives you insight into their world. So let do what they want you to do in the beginning, and then afterwards maybe then say, okay, can we do something that I want to do? Maybe sit still for 2 minutes or 3 minutes. So it creates that bond, that trusting bond between your child and you as a parent. Okay, here are some parenting strategies that you can have a look at. And the picture that I have in the corner there is quite significant. So most of learners with ADHD are like a puzzle. We must fit the pieces together in order to better understand them. And sometimes these puzzles might be difficult to fit, and we cannot force them. So that's why we have to be patient with them, and we have to praise their efforts. We have to give effective instructions, and we have to be there for them and make them feel included. Thank you for coming to the webinar. I appreciate you guys taking your time out in the evening and listening to me. I will see you on the next one.